What we did together was collaborating in this project on T-cell lymphoma in Weill Cornell Medical Center in New York City under the guide of Giorgio Inghirami. We basically faced the big problem of T-cell lymphoma, which is a very heterogeneous disease. So it's really difficult to find a cure for this patient. They do not have appropriate treatments, they do not have appropriate models that describe this kind of disease, and so our aim was to really try and find a way to make alias of the patients, and the best way was to make PDX. So basically mice xenograft which are hosting the patient cells, growing them in these models, and then harvesting them from the models in order to utilize them in vitro experiments and, for example, perform drug screenings, find liabilities like genomic mutations or alterations in expression pathways. So our aim was really to build a big library that also other people can harvest and utilize.
Yeah, I think that's one of the main points, right, of T-cell lymphoma, that there's a super heterogeneous disease, and that comes that we still have a lot of unmet clinical needs for this disease. And on top of everything, we lack models for studying the disease. So the real first aim of our work was generating models that really resemble patient disease, so T-cell lymphoma patient disease, and that's the first thing that we did. It was pretty challenging because T-cells and tumor T-cells normally do not only rely on intrinsic genetic alterations that drive the tumorigenesis, but on top of everything, they rely on microenvironment signals, cytokines, stimuli, and that's of course something that makes it difficult to generate conventional cell line for T-cell lymphoma. So we just have very few conventional cell line in peripheral T-cell lymphoma that cover specific subtypes that are genetically driven. And that was the main reason because, as Luca said, we decided generating this large collection of PDX that covers at least the most, that as of today accounts for more than 90 models. We are close to 100 and covers more or less all the different subtypes of peripheral T-cell lymphoma. And that's of course an instrument that could serve for implementing different types of discoveries. Both basic discoveries, so the mechanism that drive the tumorigenesis of T-cell lymphoma, but of course also translational discoveries, meaning that the PDX could be used as an avatar of a patient for testing new regimens, new therapeutic target therapies, and in general precision medicine, so patients tailored approaches.
And also one more thing that we were able to do thanks to the PDX is the capability of tracking clonal evolution of this lymphoma in the mice model. So what happens is that when you implant a tumor sample, the mouse starts growing it, right? So after you propagate it in multiple generations, this lymphoma can shape the environment, as Danilo said before, and like make it its home, right? So make it an appropriate environment, but then also change over time, slightly at least. So we used, for example, whole exome sequencing to track down what are these changes on a genetic perspective, and so what are the forces driving the clonal evolution along passaging. And what we saw is that mostly these
pretty
models
surprisingly,
were,
right? Because they were pretty stable.
They were really
of
stable.
Course, there's plenty of tumor heterogeneity within T-cell lymphoma. So of course we can recognize different clones at time zero, so in the patient disease. These different clones are represented at different percentages. Usually we have a dominant clone that is predominant, of course, but we still have different subclones that are mainly retained along PDX propagation in mouse. Of course, there's not a perfect model, but we still have that PDX is a stable models and overall also represent the heterogeneity of the disease, and that's a good point actually for researchers that want to study T-cell lymphoma, considering the complex disease that we are facing with.
So the last point is, as Danilo said before, is like really trying to make it from the bench to the clinic, right? So the idea is to make a translational platform that starts from the generation of the model and ends on the identification of compounds, drugs that can be used on actual patients, and then that was the final aim. So really take these mice and use them as a clinical avatar, like make preclinical trials using mice as patients and testing all the drugs that came from the drug screening, from the in vitro testings, and then see which ones are actually working, which ones can make a difference in patients. And I think this is just the starting point.
And that's something that we started doing. No? So actually what we believe is that maybe for giving a complete cure, I don't want to say the best cure, the best therapeutic option for patients affected by T-cell lymphoma, we need to switch maybe for combination therapy.
Right.
So what we did is trying to integrate data that are coming from genetics and data that are coming from compound testing on PDX models, trying to combine them, trying to debulk the disease, and then try to attach what we can define as the minimal residual disease in lymphoma with target therapy based on genetics. And on top of that, we had some nice results.
So yeah, we really hope this will work in the future and will help other researchers study T-cell lymphoma, which is a big unmet clinical need. Thank you.
Thank you very much for the invitation.